Good morning. Welcome to the Muscatine County Board of Supervisors meeting for February 11th, 2019. The first item of business is to review the agenda. Scott has moved approval.
Second.
Jeff has seconded. All those in favor? Aye. Those motion passes, rather. Now we will receive comments from the public. Anyone here wishing to make a statement on an item not on our agenda? Seeing none. Move right on to item number 4, which is discussion and possible action to approve claims dated February 11, 2019 in the amount of $252,764.20.
Move to approve.
Second. Jeff has moved. Santos has seconded. All those in favor? Aye. Next up, a quarterly update on the Eastern Iowa Mental Health and Disability Services Region with Region CEO Lori Elam and Community Services Director Kathy Anderson-Noel. Welcome, ladies.
Good morning.
Morning.
All right, well, Lori's here today, and she's going to talk a little more in depth, but just a few things that we're working on as a region. The management team is working on our strategic plan from the December meeting that we had, and also our annual service and budget plan. Big concerns we have, of course, are sustainable mental health funding, and we continue to be working with Robert Young on the crisis services and making sure that those are moving along and staying in place and things are getting done. Another thing that's come on the horizon is House Study Bill 22, and it's concerning guardianships and conservatorships, and it just adds some layers of more things like additional background checks, additional appointments of a court visitor who is different from the person's attorney. When somebody applies for a guardianship, the court appoints an attorney for the person called a guardian ad litem. And so what this bill would do would be to appoint an attorney, plus they're going to call it a court visitor, which is basically the same as a guardian ad litem. So the question about some of these things are who's going to pay that cost and how complicated does it all get. So it's just something we're going to be watching, and Lori's on the Legislative Review Committee, so I'm going to turn it over to Lori, and she's going to talk about update with the region. Thank you.
Good morning. I apologize for not being able to make it down last week or 2 weeks ago when we had the snowy, icy weather, and I'm anxious to get back home before the next snowstorm rolls in. I was like, wow, Mother Nature is not being very nice to us this year. So with that, I want to talk a little bit about the FY20 budget, and I've been making my rounds to all of the counties and doing a presentation talking about the levy piece, the services, the future, where do we see our region going. So I'm going to start with that, and then you can interrupt me if I'm talking too fast or using acronyms that you're not understanding. So please let me know. So to start off, just a quick reminder, Senate File 504 was the bill passed in 2017 that altered the levy authority and also created fund balance requirements. So that bill is looming out there. There is some discussion at the State House that there could be a bill come out this week that will change some of that. They want to look at putting a 30% fund balance requirement and a 5-year time frame to spend fund balances in excess of that 30%. So they didn't take it away totally like I was hoping, but they're extending it a little bit, which, okay, we could deal with that. But the one big piece that they haven't addressed yet, and this is where I need all of the boards of supervisors from all 5 counties, we need the legislative body to understand that 3078, our regional per capita, does not work. And so we need you to tell them that, and I'll give you some examples and some language that goes along with that. In 2018, House File 2456 was passed, and it moved some of the additional core services to core. So now we have additional mandated services that we have to make sure are available in our region. They also added 3 new services: access centers, ACT teams. ACT stands for Assertive Community Treatment. And then the Intensive Residential Service Homes. Those are 3 new services, 24/7 type services, very expensive. Those 3 are not required until July 1 of 21. Now, I have told DHS to their face that our region will not start planning, having any discussions, or moving towards development of these 3 new services because our cap 3078 does not meet our current service needs. We are not going to add any new services. It doesn't matter if they're mandated or not. We don't have enough money to pay for what we have now. Doesn't make sense to take on additional services that we can't pay for. And it's not good for our citizens, and it's not good for our providers to start something new and then have to end it in a year when we don't have any money.
I don't mean to interrupt, but
Oh,
I'm
that's
just curious.
okay.
Is there any thought process on the cost of these 3 new services that are supposedly required?
Right.
Do
The
you have
ACT,
any idea?
I have some ideas on a couple of them. We're still looking at cost on the others. The access centers, they want 6 access centers across the state. So we won't need one in our region, but we can contract with, Dubuque County has contacted me and Iowa City has contacted me. That's the East Central region. But they're wanting about $100,000 for a contract. And that seems like an awful lot of money that I don't think we will really utilize that service because we have crisis services and expanding crisis services in our own region that will deal with people and that will help law enforcement. You know, law enforcement was really pushing for access centers last year because they didn't have a place to take people. Well, we're creating crisis residential stabilization beds. We're going to expand mobile crisis, and we have a new hospital that's being built in our region. So we'll have places for people to go. So I'm not as concerned about the access centers. The access center is a catch-all. They have an evaluation component, they have navigation, they hook people up with other services, they do a variety of things, and it doesn't have to be under one roof. It can be kind of a virtual access center, but you have a connecting point, and then it matches you up with the services that are out in the community. That's what we already do now with our care coordinators. So I don't know if, I really truly don't think we need to have an access center here. We may have to contract with one, but that's going to be up for negotiation. So the other pieces, the ACT team, we already have an ACT team in our region. Vera French is running that program, and they're actually serving 3 people here in Muscatine. So they are expanding out. That was part of the agreement with some additional one-time funding that the region approved for Vera French. So they are serving all 5 counties now. They are working diligently to hire additional staff so they can continue to grow that program. ACT is for individuals who typically don't respond well to traditional outpatient services. They may not be taking their meds. They may not have a place to stay or sleep. They don't make appointments. They kind of bounce from jails, homeless shelters, to the hospital and back again. And so the ACT team is a staff intense, wrap around them, help them secure housing, make sure they're getting to their appointments. The ACT team members may go to their house or their apartment every day and make sure they're taking their meds. And it keeps people out of jail, keeps them out of the ED, keeps them stable in our community, which is what it's all about. So those 2 programs, the ACT program right now, they get reimbursed from Medicaid at about 50. It's $56 and some change per day, and they only can bill 5 days a week, even though they work 7 days a week. The state legislature is looking to increase that up to about 70, but then they have to adjust the Medicaid budget and cut someplace else in order to do that. But that was a push from all the regions.
How many people is ACT serving in the region, do you know?
34.
34, and is that expected to ramp up, or are we about where we think we're gonna be?
No, they're wanting to serve at least 100.
Okay.
So-
What's our contract, is Vera French the only one doing that?
Yes.
What's our contract with them for that cost? I know we did the one time, but do we have ongoing?
There will be ongoing in our contract for FY20. We did budget about $250,000 ongoing, and that dollar amount is just for people who aren't on Medicaid yet, and they help them apply for Medicaid and get that funded.
So that's about $2,500 a person.
Yeah. Some of them that they're serving, the 34, are already on Medicaid, and we don't have any expense for them.
Okay, so I mean, that seems to me like maybe there's more lower hanging fruit elsewhere we could go after. Not that those aren't important, but before we're spending $2,500 a person, I mean, my gosh, that's almost the cost of a home.
Okay.
You know, and I don't know if I'm really asking anything. I'm just trying to figure out what the thought process is in mandating this service.
Yeah. Again, they're trying to address folks with complex needs who frequent our jails, emergency rooms, and homeless shelters. And so the ACT team is one service that can help address that. They don't stay in it for a lifetime. They may only be in the ACT program for a year and a half. And then hopefully they're stable enough where they don't need that constant staff intervention.
Do we have any kind of data from other places that have tried it as to what the stabilization rate, if you will, is?
Iowa City has been running an ACT program for years, so I can reach out to them and get some of that data. And I know that Rich Whitaker from Vera French was going to give an update on the ACT program at our February 25th meeting.
I'm just curious what our return on investment would be there.
Yeah, yep, I can look for you. Yep.
One of the things that troubles me is so we continue to see, we went to regionalization a number of years ago to try to get more consistency, but so why is the state continuing to push programs on the regions? Because we're trying to, I thought the whole notion of regionalization was us to take care of the needs in our regions. They could be different region to region. And so here again, we're just perpetuating the same problem we had, where we're pushing services that may or may not work or be needed in a region.
Correct.
And yet you're gonna have to add them, so if you have to add that contract, we're already doing it. What's the, it's like, it's insanity.
I would agree with you totally. My wish for DHS was, and the state legislature was, to leave us alone for a couple of years and let us do good things and let us get our feet on the ground and moving forward with some good services and see what our rates are in terms of hospitalization and commitment and in the jail and the homeless, and see if we can improve things, stop making changes legislatively. So.
If you're a hammer, the whole world looks like a nail, I suppose, and
Right,
everyone
right.
thinks they're the only ones that can fix anything.
Right, right.
Yeah, and I still, I don't know how, I look at the 3078, because when this whole fiasco started, they were talking 5579, something like that, 5479. Am I right, Lori? Somewhere in that number, 54, 55. But so we're significantly, regionalization. We've seen a significant improvement in the per capita cost.
Right,
They just have to let us kind of figure out where that number is.
right.
Are you thinking it's in the $36 range?
I'm thinking it's anywhere between 40 and 45.
40 to 45?
I don't think we would need 4728, which was the original magic number back in 2014. But, I think 40, 45, that would be sufficient to do the services that we need in our region, as long as they don't make any other changes legislatively.
Have you heard any talk around the legislative session of increasing or removing the cap?
No,
That's a problem.
that's the big issue.
All I've heard is that they're contemplating dropping the requirement of the the spend down requirement on the balances. I have heard nothing
Right,
else.
and that's, I mentioned when I first got up here, was they're changing that fund balance requirement from 20 or 25, they're moving it to 30, and that they're giving us 5 years to spend down fund balance rather than 3. But that doesn't help matters, you know, the bottom line is our cap, that $30.78, just doesn't work.
They're working on a symptom, not the problem.
Right, right.
Now, is there any funnel time concerns with legislation in this regard?
I don't think the 3078 with the cap, the funding piece, I think because it is dealing with appropriations and funding, I think it's funnel proof. But I also heard that there was gonna be something coming out this week. We know that Representative Fry was working diligently trying to get something drafted, so.
Thanks.
Now, with FY19, I wanna give everybody a reminder, so then when we move to 20, you'll understand the bigger picture. In FY19, our adjusted budget is 14.7 million, the year we're in right now. The revenue coming into the region is 4.1 million. We had 4 counties levy 0, which was fine, and we had 1 county who raised their levy slightly because of Senate File 504. We needed to lower revenue and increase expenditures because we had this huge fund balance sitting out there, and part of Senate File 504 was you needed to spend that down. Otherwise, the state was gonna come in and tell each county what to levy in 22. So we did what we needed to do. We jumped on it right away and did that, and that was fantastic. We did one-time funding grants for lots of local providers. We provided 1.3 million to several local providers to expand their services, supported employment, peer support, the ACT team, lots of good things happening. We also expanded the crisis services contract with Robert Young. So we'll have mobile crisis in all 5 counties very quickly. We have peer support now available in 3 out of 5 counties. And keep in mind, we don't have to have every service in every county, okay? It just has to be available. Our region is responsible for providing transportation if somebody needs that service and needs to get there. We also have 2 counties drawing down from the region to make it through the fiscal year to pay for their own services, which again is fine. It's all part of that fund balance reduction. Now, if all of the dollars that we budgeted for FY19 were to be spent, we'll end up with a fund balance of about 1.1 million, which is kind of scary, because we started with 8. Now, we're not going to spend every dime. Won't happen. We consistently spend between 60 and 70%. So, if we look at 60, 70%, where would we be? We're probably going to be about 5.6 million in fund balance at the end of FY19. Now, with that being said, if we were to all levy the 3078, all 5 counties, we generate 9.2 million. So 9.2 million and 5.6 million, we're looking at about 14.8 million. Our budget projections, and again, this is very preliminary because I'm still working with some of the other counties to get me their final numbers. We're looking at a budget for FY20 to be about 13 million. So we're just gonna squeak by in FY20, which is fine, but that's why I'm pushing so hard for having all of the elected officials, the boards of supervisors, push that 3078 doesn't work. We are constantly developing budgets that puts us in deficit. We can only generate 9.2 million, but yet with all of the core services, the crisis services, we end up at a budget of, you know, between 13 and 14 million. Now, we also have the kids system that's lurking out there. We have no idea what it would cost. And right now, the kids system at the State House is kind of come to a screeching halt. I find it very interesting because that was such a big push at last legislative session, and then all through the summer and fall. The work group was meeting, the governor was behind 100%, but now it's come to a screeching halt because nobody wants to put a price tag on it. So again, comes back down to money. So whether the regions will be in control of that or not going forward, I don't know. We've made it very clear that don't give us an unfunded mandate because we cannot manage it without the dollars going along with it.
So Lori, let's say we do go into deficit and we don't add the things that they're telling us we have to add by 2021. What happens?
We won't make it to 21.
Oh, I know, but
Yeah.
let's say we don't do what they tell us.
Mhm.
What happens? Do we get the Des Moines slap, or
You know, I don't know.
they take this thing back over?
I don't know. There's a report that came out, and I forwarded it to all of the board, the governing board members, that gave the history of the mental health funding going back to 1996. And then towards the end of that document, it talks about what some proposals might be. They talk about the state buying out the system. They're not gonna find 115, 120 million to buy our system. We know that's not gonna happen. Will they do a combination of property tax and sales tax? That's very possible. Sales tax, a dedicated 3/8 of a penny is what was discussed last legislative session, which would be fine, but when the economy goes south, then that money would dwindle as well. And, you know, the problem is you start services, you don't wanna have to start and stop and start and stop, and rebuilding and doing all the infrastructure for those type of things it's really difficult. So they're looking at different possibilities. The other big possibility is they allow the regions to determine what you need in terms of a levy amount based on the budget that's approved by DHS. It's not like we're gonna be creating some wild services out there. The budget has to be approved by DHS by April 1. So we need that local control in order to do the things that DHS wants us to do. My fear is if they kick the can down the road and not fix this again, that we will be making cuts in services, or our region could totally disband, which would be really sad, given all the work that everything has been put in place. So we have some struggles, and I'm sure that things will get heated in Des Moines when we start having some folks put pressure on. Because nobody wants services to be cut. You don't want to lose what we have in this county or next door in Cedar, Jackson, Clinton, or Muscatine, Scott. We don't want to cut services.
What just boggles my mind is continually is that no one is asking Des Moines for a dime.
Right.
We're asking to tax our own people
Right.
for
Yep.
our own services.
Yep.
And
Yeah, it would be you taking the heat if
Yeah.
there was a property tax increase. They're not going to associate that with anybody in Des Moines.
no.
And so, yeah, it's you that will be promoting, this is what you're gonna get. These are the services that are gonna be here now. This is how we're going to help our families and our individuals in our counties who have significant needs. You know, that's what we need to be touting, so.
One of the things that I wonder, Lori, and I don't know, maybe we're more successful than I think on this, is one of the things I think our region fails at often is we have a pretty strong and a large legislative contingency when you look at the counties in our region. We could amass, and I wonder if maybe we should try to make some efforts to pull that group together regionally here and sit down and try to put a little more pressure on the legislative groups about solving this problem once and for all, because this has been sitting here for years.
Yeah.
From the start of from this deal, and I know there's a lot of key influencers in the process in this region by us, and I just wonder sometimes if we're bringing the political clout that this region has to the game effectively or not. If that's something the boards should consider, is getting our legislative bodies together and seeing if we can't put some more pressure on this, because enough's enough. It's just ridiculous. They continue to do the same stuff that got us into the problem in the first place, mandating services we have no funding streams for, and they won't let us fix our own problems. We're not even asking them for state dollars. These are local tax dollars we're talking about. Just take the shackles off us and let us do our jobs. Last I checked, the DHS was not elected. We are. We report to the taxpayer, and I don't know why the DHS has so much power over our purse strings, because quite frankly, they haven't done their job very well from what I see. It's just frustrating, and I think it's, I just wonder if the board should try to put more pressure on by getting together, trying to get our legislative groups together. I know that's a big task, because there's a bunch of them. But if you look at, at these counties, we added up the number of representatives and senators we have a lot. And we could bring some pressure to bear.
Yeah, 10% is 10% of the state's population right here.
Right,
I
right.
mean, that's gotta be worth something.
I had about 6 weeks ago, 2 months ago, I had a great meeting with Representative Carlson and spent 4 hours with him and gave him some history of mental health funding, but then talked about all of the legislative impacts that have happened the last 2 years and where our region's at and where we want to see it going and what we needed help with. So he understood that, but there's key people in Des Moines in the leadership that control those decisions. We could talk to everybody at the State House a million times, but that's not gonna matter. There's key people.
Do we know those people, and do we know who has their ear?
Yes, we do. And Representative Fry is one of them. And, we've been having conversations with him. The ISAC, entity has been having contacts with him. The Speaker of the House is a key player as well. The governor even mentioned in her State of the State address about the importance of mental health funding. And so everybody knows it, but nobody wants to seem to pull the trigger to say, yes, it's okay, do this. And so that's why I'm thinking, maybe if they keep hearing from every single board of supervisor from our 5 counties saying, it's okay, we don't want our region to blow up, we don't want to lose services, it's okay, let us take the heat, and if we just keep hammering that message, maybe that would help. You are the elected officials. They don't like hearing from me. They hear from me a lot, and it just doesn't seem to have much impact. So, one thing that our region will be doing to help stretch our dollars for FY20 is doing, we're gonna be implementing an assessment tool. So we're gonna be looking at everybody who's in an RCF, a residential care facility, whether it be in the region or outside of our region that we're financially responsible for. We're gonna be doing the assessment to determine, is that the level of care they really need? And if it isn't, we're gonna bring them back and hook them up with providers here locally, and they can live in the community in their apartment. They can draw down Medicaid dollars through habilitation or ID waiver or whatever it would be. We want to utilize the Medicaid dollars before we utilize the county and regional dollars. So that will be a big impact. The other piece that we're going to be doing is meeting with our vocational providers, the sheltered workshops, and we need to kind of draw the line in the sand and say, we need you to be doing pre-voc. They need to be learning skills that they're going to move out into the community. If not, which we know some of them won't, then we need to utilize DayHab, which again is a Medicaid service, and we'll put the push on Medicaid. And then we want them also to move towards supported employment. And we have some fantastic things happening with some of our sheltered workshops. So it will lower our expense if we can utilize the Medicaid dollars, which is a good thing. Stretches our dollars so we can do some of the crisis stuff and have Medicaid pay for the very basic things and not the region. So that will be a change in FY20. The other piece, you know, what happens with the 3078, I talked about the deficit budget. You know, we can't meet our current service needs, but the other piece of this is fund balance is one-time funding. You know, once you use it, it goes away. It's not like, you know, in my savings account at home, but, you know, I take money out of my savings, it's not replenishing itself. I wish, but it doesn't happen. And so our fund balance is the same thing. We use fund balance, it decreases. It's one-time funding. The state doesn't use one-time funding to manage their budget. Why should they expect the region to do that? It's not good business practice at all. You know, having a planned decrease of fund balance for something specific, you know, you plan it, you know it's gonna happen, that's fine. But to do this year after year after year, pretty soon we're gonna run out, and then what do we do? Where do we turn? So we don't wanna have to cut services. So with that, I need your help. The region needs every supervisor's help to send the message that 3078 is our cap, and it does not work. It only generates 9.2 million. For the 2 new supervisors, to give you some idea where these 3078 came from, is back, they looked at the FY15 expenditures of each region and divided it by population. In FY15, we had only been a region 1 year. We didn't have crisis services up and running. Excuse me. So they've given us a cap based on 4 years ago what we spent. Now look at us. We have crisis services up and running. We're doing some really good things. We have lots of new services and we're expanding. 3078 is not appropriate. It's old. It's an old number. Doesn't make any sense. The region right next door to us, eastern Iowa, central Iowa, their cap is 36 and some change. So we're sitting here on the far eastern side of the state with $30.78 per capita. It's just not right. So if they were to ask you, how do we fix this? You say, let us have local control and determine where our region needs to be based on the budget that the governing board approves. We roll all 5 counties together, so we make sure that all of the services in each of the 5 counties is where it needs to be. And we roll them all together and include the crisis services for all 5 counties. So we need local control in order to pay for that. We need you to determine what that level needs to be, whether it's 35, 40, 45. You know, if they want to keep a ceiling on it, let the ceiling be 4728, that's fine. I don't think we need that kind of money. So, you know, again, we need local control. We need to be able to control our destiny in terms of what services are needed. With that, any questions?
No, I'd just make a comment. I saw the report, I don't know, one of the I think Representative Carlson sent me a deal where you'd reported out and done it. I appreciate the hard work and the effort on our behalf.
Yeah, thank you. I respect all of the legislators that are on that interim committee, and I've worked with many of them for almost 12 years, so they know me and they respect me. My report was very straightforward. You know, they created an unfunded mandate again. They have bouncing levies. They didn't realize that. There was a unintended consequence across the state, and they know how important services are, and they know that I'm very passionate about making sure people have what they need to be stable and happy. So I'll continue to fight that fight, so.
Lori, I have a couple of questions.
Yep.
Do you know if Scott County published its budget yet?
It did go in the paper last week,
What are they looking to levy for mental health?
3078. Yep, and Cedar is also 3078. I believe Jackson has gone that route as well, and Clinton as well. So I've made my rounds to all 5 counties.
We're there as well, so.
Great. Great.
The other thing I wanted just to give you a heads up in case you aren't aware, and Sherry can speak better to this than I or anyone else, I think, but there's, I guess the region was gonna request from us a certain amount, and you wanna just explain that real quickly, Sherry? What we talked about?
At the end of our budget process, I think Kathy found out that the region was gonna ask for $375 from Muscatine County, which we have not included in our budget. If we do include that expenditure, we would end up at the end of 1920 fiscal year, $127,000 negative fund balance. So we can't fund a payment to the region. So, and as it is, I guess, is there any thought about whether the region's gonna be able to help us maintain a 20% fund balance, or is that done?
Well, okay, so a couple questions here. The transfer dollars is what she's referring to, and I believe at the last 2 governing board meetings, David Farmer, fiscal agent, had handed out a form showing what the region would look like, based on current expenditures, and what FY20 would look like based on current expenditures and movement. And the transfer dollars are needed from all 5 counties in order to fund the crisis services and admin and purchase admin. So, these services are essential to keep our region going, and the purchase admin, that is the insurance, the Vortex, the Karosh, the HIPAA piece, the website, all of those things together. And I know that Clinton County is in the same boat. They're looking at how are we going to fund this. And so my question back to supervisors is, what happens if you submit a negative budget? What happens if legislators know that in order to keep our region whole and at the current service level, we don't have enough money, so we're submitting negative budgets? What happens?
There's potentially impact on grant dollars that we get for other areas.
Okay.
So it's not what I would suggest we do.
Okay.
That's not my decision to make, but.
I mean, that really draws a strong picture for our legislators to say, look what's happened. We can't get through 20. We have 2 of our county members that are now going to be negative if we fund our share of crisis services and maintain the current service level. We're not adding anything new to our services. We're not doing we're not doing access centers or the intensive residential service homes. The ACT program that Vera French implemented, that was done a year ago, so we'll continue to fund that just like some other basic services.
So, that being said, what happens if the region turns in a budget that's a negative fund balance?
I don't know. I
That
don't
may have
know.
more impact than individual counties.
Right. The region, what happens is each county's certifying their budgets by the 15th of March. The region has to submit an annual service plan and budget by April 1. I wouldn't have a problem with sending in a negative budget.
Because, we published our budget and it does not include that.
It's not like we're levying the max, it's not
And
like.
we're levying the.
Right, it's not like we're not doing what we
We're
need
just
to
sitting on
do.
a pile of money and not saying,
Right.
we're gonna say, hang on to this.
Yeah,
It's-
that's
Right.
the frustrating thing. We did what they asked, what they forced us to do, and now they forced us into a corner, which we all said was gonna happen.
Right,
But they didn't pay
Yeah.
attention.
And I'm afraid that the message that may have been going out to legislators is that you've got another year before you really start hitting metal on metal, and
Right.
I don't think they do.
no. We have the governing board has a work session this coming Friday, the 15th, at 1 o'clock to work on the budget. And so I'm gonna be presenting the 5 counties and the regional budget, rolling it together. So all of them will see that, and I will bring that question up in terms of what do we do for a couple of our member counties? You know, they can't submit a negative, or could they? What happens? What happens if our region submits a negative? What are they gonna do? Our budgets are all property tax. It's not any state dollars whatsoever. And so somebody had asked, well, what happens if, what can DHS do to us? I don't think they can do anything to us. These are local property tax dollars.
Well, and we've published our budget, so we don't have the option now
Okay.
to make that change.
Okay.
It would have to be 312,000 cut from what Kathy's other expenditures are if we did that.
Yeah, and Clinton County was in that same boat, so I was supposed to meet with them again today, but whether, I'm not sure if I'm gonna make it up there this afternoon or not, but we'll have that discussion on the 15th, and I can definitely get back to all of you. Maybe it's the region submits a negative budget, you know, and that would include all the transfers. So,
I'll tell you, I would strongly advocate for that position.
Yeah, I think so too. You have to make the point.
right. I don't mind being the rebel and being in the
Well,
doghouse
I
with
feel
DHS,
like, I feel like
so.
we've warned them for 4 or 5
Yeah.
years, Lord.
Right,
It's not
right.
just a new thing. We've been talking about this for years,
Yeah,
and they've done nothing. They've sat on their hands.
yeah.
And well, I guess worse than doing nothing, they've boxed us into a corner. They've allowed us to do nothing.
They, over the years, you know, they froze the levy way back in '96, and then they provided some state funding, you know, periodically over the years. Then mental health redesign passed in 2012. Then they gave us some equalization dollars 2 years in a row. They allowed folks to bring down their levies to 4728, which was great, but they've never really addressed the issue. And they just continue to do Band-Aid fixes and prolong the agony. And, you know, we don't want to see our region die a slow death. We're not going to keep cutting away at services, because some of the services that could potentially get cut are what keeps people stable in the community. And we don't want to lose that.
Yeah, maybe what they need to do is just raise the income tax, cut the property tax, and get the mental health levy out of the counties, and they take care of it. That's their problem. They seem to have all the answers.
I'm not holding my breath.
Yeah.
Historically, those things don't go well.
No, you're right, they don't at all.
That's why we have home rule in Iowa, right?
Yeah, yep. Yeah. Any other questions?
Thanks, Laura. Anybody else?
Thanks so much for
All
coming
right.
down. Good luck.
Yeah, I will keep you updated on legislative changes, and if something comes out this week, I will definitely send it your way, so.
Okay.
All right.
Kathy, did you have anything further?
Nothing further unless you have any other questions for me.
Anybody have any questions? Kathy?
Just one thing I do want to remind you of is if we have to cut services for any reason, they have to be cut throughout the region. It can't just be one county cutting, you know, a little bit of this, a little bit of that. It's region-wide, so if we would have to do that, we'd have to look at it regionally.
Not holding you to anything, but if you had to make a cut right now, what's the first thing you'd think you'd cut?
You know, the state, DHS doesn't like sheltered workshops. So if we had to cut something, there's a significant chunk of money involved in those, and, you know, we have workshop all 5 counties. So that would be a huge devastating hit. RCFs, that's where people live and get their care 24/7. We're gonna move some of those people back, so there will be a savings there, in utilizing Medicaid. We have community support programs, in 3 of our counties, and that allows people with significant mental health issues to, get meds, get a new meal, have eyes on from nursing or a therapist. Just gives them a place to go during the day so they're not isolating at home. If that goes away, you know, we would see some increases in our mental health commitments.
Well, wouldn't you, Lori, you know, this is the age-old question, you know, I know that, you know, somebody at the state doesn't like sheltered work. I happen to believe sheltered work's a good thing, and one of the questions I have is I don't think they fully contemplate, you know, to me, it's a lower cost alternative for people that are, you know, quite frankly, this is just the best place for them.
Yep.
And you're not gonna serve them and help these people anywhere for less money than they're doing with sheltered work. So you're gonna drive them to a more expensive service and probably make the problem even worse.
Right.
And I just don't understand that way of thinking, and it's just,
Yeah.
it's always troubled me.
Yep,
One of the
I
things-
totally agree.
So I think this is an area that if you cut service, it's like the alligator game, right? You're gonna
Yeah.
knock this one down, pop, you're gonna start bleeding somewhere else. I don't think you have a population you have to serve. It's better for the communities that we serve them, and we're trying to do it in the best cost-effective manner that we can.
The other thing too about sheltered work is our local provider is really getting into the game, you know, looking to expand and looking at those people that maybe sheltered work isn't the best, you know, alternative for, but they need time to develop their program. You know, these things don't happen overnight, and they are working on it, they are working on some things and looking at, you know, some bigger picture things on maybe they can serve other populations. So I think, you know, if we get into a predicament where we have to cut service, it doesn't really allow them time to get where they need to be, and that's unfortunate. Like you said, Jeff, it just involves, you know, paying for other services.
Well, I just look at, when I look at sheltered work, because I know, like in our own workshop, there are a lot of private sector dollars that go in to help provide that work.
Right.
And if, you know, that's money that's not accounted for in this care. And it's gonna come out of the taxpayer's pocket if it doesn't come out of those pockets. And I just I don't think people fully understand what they're doing.
Several years ago, when I was doing a lot of advocacy for funding, and this was before regionalization, one year, I took up just a brief talking points about allowing the counties to raise their levy based on their budget that again is approved by DHS. And I attached candy. Do you know, how many of you remember the candy called Now and Later?
Is that like Mike and Ike kind of thing?
Kind of.
Yeah.
Yeah, they're hard things, but they soften up. But you're either gonna pay for it now or you're gonna pay for it later. And I had that candy and talking points put in every legislator's box.
Maybe
At
they
the State House.
order that.
Yeah, you're right. I mean, we're gonna pay for it someplace else if you eliminate this
It's
service.
possibly our jails.
Right, right.
It's our, you know, our court system that's gonna feel the pinch or something, because, you know, we know that, you know, this is a population, if you're not providing this kind of care and attention, that the issues are gonna manifest themselves elsewhere. They're not gonna go away. They're just not
Well,
gonna
the
go
other
away.
thing too is, you know, this gives people a meaningful place to go, something meaningful to do during the day. Do you want them sitting home, eating Cheetos and watching TV all day?
No,
I don't think so.
no.
Folks will get in trouble. They'll get
Yeah.
bored. You know, their family members are gonna worry about them if they have to work and somebody's at home and do they need supervision, you know, it racks up a lot of concerns and issues.
What's the number one thing that the state doesn't like about the shelter workshop? What do they feel doesn't work, or what do they feel has a negative impact?
Segregation.
They don't like the congregated work setting where you have large numbers of people with disabilities together. They don't like RCFs either. And our region had our hands slapped a couple years ago because of the amount of money that we paid for those two services. But if we didn't have RCFs, those people would be in our jails or in our hospitals taking up a bed that somebody really truly is psychotic needs.
I find it total hypocrisy when it's okay that we have senior centers and we have our senior housing together and all this, but we have people with, I mean, it's all about a cost to serve, you know, I know, and we look at those supported community living, because I'd look at the budget dollars on those, and that is a very expensive way to care for people, because you have freedom and autonomy of those people. And so you have to overstaff every one of them. And if you're only serving 3 or 4 people, it just gets to be an enormously challenging project. So then what the givers do is they go to lower cost help. Well, maybe you're not always getting the best help you could and the best care. It's just a terrible situation as far as I'm
And all of the
concerned.
providers are really, really struggling to, hire and retain staff.
Yep.
That's probably their biggest expense.
Yep. And all the overhead expenses, all the documentation requirements, all that stuff, it's just insanity.
Would it help if I put together some brief talking points and send it to Chairman Mather, and you can send it out and you guys can start?
I think it'd be a good idea that,
Send it out
and
too.
then ask all the board members, and I'd share it with every board, and ask them to get their legislative contingency. 'Cause we need more of these people, sitting down. I know even in our example, I think we have some that really get it and some that don't.
Right.
And that's not good for us. They all need to get it.
And maybe throw in the various committee and subcommittee chairs and ranking members as well in there. You can throw in their phone numbers and emails, that'd be awesome.
I can do that.
Save us a step. I know it's a small step, but it would really be helpful, I think.
Well, back in 2007, 2008, the squeaky wheel got the oil. I was having busloads of individuals go to the Capitol and talk about what services would be cut and what it would look like, and we had a huge state appropriation that year.
I don't think it would hurt to alert
So,
all the members of the media as well. How this is really going to
I will work on that today.
Thank you so much,
Okay.
Lauren.
Okay.
Thank you,
As always,
ladies.
guys, thank you.
Good job.
Next on the agenda is item number 6, possible action to accept for publication the Muscatine County Treasurer's semi-annual report for July 1st, 2018 to December 31st, 2018.
Move to approve.
Jeff has moved, Santos has seconded. All those in favor?
Aye.
It's approved. Next up, discussion and possible action to approve the minutes of the February 4th, 2019 regular meeting.
So moved.
Second.
Scott moved, Jeff has seconded. All those in favor?
Aye.
Correspondence, Santos? Jeff?
Had a invitation or notification to the Slag Committee is having a public meeting to update on their progress on February 26th in the Wilton Community Center. I will be unable to attend as I have a prior commitment with another group that evening, but, and I believe we have the conference board that with our budget publication that night. But that's all I had.
And I think we all got that. That's
Yep.
the only thing I got, and I know that the state, public health folks and DNR were gonna conduct testing and hope to have the results of that testing done by the end of the month, hopefully in time for not only us, but for any members of the public who'd be interested in it. It was, going to be weather permitting. As we all know, the weather in the last couple of weeks has been less than stellar, so we will see. Hopefully we'll get that information ahead of time. Scott?
Actually, the only thing, that I had was I don't know if this is, applies here, but we actually had the conference board meeting on Tuesday the 5th. And, that's the only thing that I had, as well as the other thing, that Jeff mentioned on the public meeting coming forward. That's all I had.
Good.
Conference.
Okay. All right, so yeah, so committees that obviously was used. Well, Scott, I did not have any. Jeff
I just did the conference board as well.
and Santos.
Conference board as well.
One thing I did know, and I guess this was correspondence week. There was a nice article in the Journal about an officer that saved a life
Oh, yeah.
last week, and we got a nice email. I think it went out to all the Muscatine members and it was passed on. Fantastic work. We just congratulate all of our public safety people who work so hard to make it, to save lives and to keep us safe in every situation. So thank you for that. Number 10, to receive any information from county employees. Anybody have anything? Nancy, anything with the administration office?
No.
All right. Does anyone else have anything for the good of the order? We are adjourned.